Social protection consists of programs and policies that help address risk, vulnerability, and poverty. The vulnerable groups include orphans, the handicapped, the poor, those facing starvation, among others. The Government of Kenya, through the Ministry of East African Community, Labour and Social Protection, is addressing the issue of social protection in the country. This is done through the Hunger Safety Net program, cash transfer for orphans and vulnerable children, older persons cash transfers, and cash transfers for people with severe disabilities.
When the Jubilee government took over in the year 2013, they did promise the nation that they'll increase the amount of funds that is going to invest in its vulnerable people within the society. That program has since grown from 250,000 households to over 800,000 households. The government disburses over 18 billion Kenya shillings to all the 47 counties, targeting the old people, targeting vulnerable children, the orphans, and also targeting people who are disabled.
Social assistance and through the cash transfer programs, one really goes directly to speak to the issue of poverty reduction, because it is one program that really does focus very directly to the most poor who are living below the poverty line. And I must say here, we are talking about 60% of our population who live below the poverty line. I think it's the one single program that truly targets the underprivileged in our society.
Some county governments have also taken steps to provide social protection for vulnerable groups. Kwale County, in conjunction with NHIF, has come up with medical insurance to help the elderly get access to medical care.
For us as a department, we thought of creating an insurance support to look for modalities of how we can be able to support the very elderly, especially people above 60, to be able to access services to our hospitals at no cost. I mean, where they're given some insurance cover and they'll be able to do that.
Kakamega County, with the support of UNICEF, has come up with a program that supports pregnant mothers and babies up to the age of 18 months.
There were very high maternal deaths and neonatal deaths in Kakamega. And therefore, he thought for us to increase the survival of mothers and infants, it's better we come up with this program so that we can encourage most mothers to deliver from the health facility and to encourage most of these mothers to come for ANC attendance and child welfare clinic.
Bomet County has a cash transfer program for the elderly similar to the one run by the national government.
We started what is called a social safety net program, which is a program targeting the old persons, those who are 70 years and above. These people are paid a stipend of 2,000 shillings every month, and also we pay them NHIF. For NHIF, contributions, so that when they go to any health facility, they can be attended to without them paying for anything.
The beneficiaries have greatly benefited from the initiatives and have positive things to say about the programs.
Sasa hiyo pesa natusaidia chakula, hospitali, nguo yake natusaidia.
Kwa sababu nilikuwa sina uwezo wa kuwasomesha watoto, lakini sasa napata pesa na wapeleka watoto shule wanasoma.
Because of this intervention, the cash transfer for the orphans and vulnerable children, more of them are able to attend school and more regularly. And then another and very important finding was that the ones who are on the program at the CTOBC do not engage in very early sex compared to the control or to other children in the community who are not receiving that cash transfer.
Implementers of the programs on the ground have to deal with many challenges. Some of these are identifying of deserving individuals, accessibility of the beneficiaries, among others.
Wale ambao wanahusika wao wanaweza kuelimishwa. Naomba. Kwa sababu hata mimi pia naomba pia nipate elimu zaidi, kwa sababu kinyanjani kuna mengine ambayo ni mazito, lazima niwe naweza nikielimishwa. Nikielimishwa nitasaidia zaidi, na hiyo ndio lengo langu.
The major challenge, we have not been able to have all the people who qualify into the program. Secondly, the challenges of logistics are there, but we are surmounting them.
Some of these programs by the county governments are, however, similar to what is provided by the national government, and as a result, there's a possibility of duplication and double dipping. Steps are being taken to ensure this is not the case.
So we don't want people to be double dipping. If you are in national, we automatically remove you from the county program. Same to the national. They also remove those who are in the county program so that we can widen the net to serve others.
We want to harmonize the issue of targeting. So we must harmonize this so that if you are targeting, then we have got a harmonized way of targeting, so that some people don't feel that some programs are better and some programs are disadvantaging them.
The Social Protection Secretariat is in the process of addressing the many challenges experienced in the programs.
By having the single registry together, then we are able to see from the system whether there is a household that is receiving a cash transfer from another program. The single registry is currently bringing together data from 5 cash transfer programs. All these programs have different MISs, management information systems, which then feed into the single registry.
Funding of these programs is a major hurdle, as the amounts allocated can hardly satisfy the need on the ground. As a result, the government has partnered with donors such as World Bank, DFID and UNICEF to provide both finances and technical support.
WFP works with the national government as well as the county governments to ensure that everybody, women, children, men, youth, have the best possible balanced diet all year round. And while addressing this particular need, it also supports the government to ensure that it continues putting in place the right kind of mechanisms that will move the country not just from the current economic level that it finds itself in, but it should be among the developed countries in the next few years.
We also broaden the scope of the investment lending to support the government for the 4 cash transfer programs that constitute the National Safety Net program. The investment lending constitutes support to capacity building, strengthening the systems for better delivery of the Safety Net program.
Legislation is a critical aspect in social protection. Without a legal framework, there are no guarantees that subsequent governments will sustain the programs. Efforts are being made to entrench social protection in the Constitution so as to make it mandatory for the government to support these programs.
How can the county government pay without a proper legislation? That is why we came up with that legislation, so that it can be able to give a legal standing to the county to be able to do that things without being told that you have broken the law.
We have been apportioning money, but the legal aspect has been our challenge. We have a policy for that matter, but we now want to get into the bill, because you can have a policy without a bill, you cannot proceed.
In Kenya, Utafiti Sera is a process, space, platform, forum, and a vehicle for transforming evidence-based knowledge for policy uptake. The Partnership for African Social and Governance Research, PASGAR, has supported major policy-relevant studies on social protection, employment creation, urban governance, and city transformation, with the aim of informing and influencing policy in these sectors.
What the Utafiti aims at doing is to bring all of these actors, policy actors from the private sector, from the public sector, from the civil society sector, from the research community, into what we call Utafiti House, where we discuss issues that research has provided evidence. And in social protection, with the support of the African Institute for Health and Development, PASGA has a competent national organization that it is working with to translate research that PASGA has undertaken in addition to all social protection studies in this country, and that we can find anywhere. That will inform what Kenya government policies and programs on social protection need to focus on.
Numerous research papers have been written for different reasons. The research findings, however, are not necessarily implemented. It is important to be able to bridge the gap between the research findings and the reality on the ground. There are different reasons why this is not currently happening.
So also the way the research is packaged is that every time you must have the popular version and you have the academic version. The popular version is the one that now, it's like an executive summary, but very exact graphs, figures, numbers, that tells you and even gives some suggestions on what needs to be done. Very crisp.
The research being done is influencing policy, but it's only but some percentage, it's minimal percentage. Because policy, apart from the research, let's say you have research output available to a policy maker. The policy maker still has to leverage so many other factors, including issues of sometimes equity, sometimes is the budget, sometimes is the minimal resources that they have. So as much as they may have research output, the other variables and factors that influence policy making can make you think almost that research has not informed policy.
The understanding that researchers are not there just to critique, they are there to add value. And that's where the synergies come in. And synergies are only built over time through mutual interaction and mutual respect for what I can bring on the table. So essentially what you're saying is that when we come to the table with researchers, we are critics, of course. But again, we are adding value to what the policymakers are doing. So through this interaction, through building mutual trust between the three key players, researchers, policymakers, and implementers, sit down around the table and say, so what research makes sense, or what evidence do you require, or we have this evidence we feel is important.
At the end of the day, there is need for all stakeholders to work together in order to come up with policies and programs that solve the issues on the ground to the benefit of the population.